have a bone-dry, shiny new, brand-new Health Secretary, Sajid Javid, and he's expected to announce today that those who are double-jabbed and come into contact with a positive case will no longer have to self-isolate.
It comes as Boris Johnson insists he's pushing ahead with the removal of almost all remaining restrictions in England on the 19th of July, despite warnings that the pandemic is worsening. So let's welcome the new Health Secretary, Sajid Javid, who joins us now. Very good morning to you.
Good morning.
Good morning.
Yesterday, in the press conference, Patrick Vallance, the Chief Scientific Officer, said with a sigh, we're in the middle of another increase. It's going quite steeply. The most recent 7-day average is 25,000 cases. Today we saw 27,000 cases. The number of cases is increasing. The doubling time is 9 days. It's mainly younger people spreading up the age groups. There is no doubt we are seeing an increase in case numbers, he repeated. Have you lifted the restrictions too quickly?
No. So, first of all, we need to find a way to learn to live with COVID, and that's why we announced these easing of restrictions from July the 19th, subject to the tests that we've already set out being met by that date. But the reason that we can lift these restrictions, and to answer your question directly, is because of the vaccine. Over the last few months, the country has built up this huge wall of defence from the vaccine, and we've had the most successful programme in the world in terms of take-up, and all the evidence is that Patrick is seeing, that I'm seeing, and others, is that the link between cases and hospitalisation and deaths has been severely weakened, and that's what's making the difference now, and that is the reason that why we can move forward and start easing these restrictions.
Well, that's a very clear answer, but you can understand why there's confusion across the country this morning. I mean, it's shown in our responses we've had from our viewers. About half of them think this is a good idea and half think it's a terrible idea. And isn't that because it was a bit embarrassing yesterday? Your Prime Minister sort of stood there in the middle and made the statement that you just endorsed. And then almost straight away, on either side of him, his two principal advisors over the last 18 months radiated disapproval. It was absolutely obvious to anybody who understands body language or actual language that they didn't agree. They didn't agree with this. So isn't that a very confusing message to send out to people? The Prime Minister says one thing and his advisors clearly think another.
Well, I have to say I don't agree with your description of the Prime Minister's press conference. I wasn't there myself. I was making a statement at exactly the same time on the same issue in Parliament, but I did see it afterwards. And what I can tell you, in terms of our two principal advisors, Chris Whitty and Patrick Vallance, they agree with the easing plan that we announced yesterday, because we follow the data and listen carefully to what the scientists have to say. Ultimately, of course, we need to make a decision as ministers. And I can also fully respect that there are people out there that some will say that you're not moving fast enough, but others are going to be a lot more cautious. And I understand that. And as ministers, and certainly as the Health Secretary, we have to make a balanced decision and look at the evidence. And what the evidence is showing us is that the vaccines, this wall of defence, it is working. And again, if you look at the take-up in the UK of the vaccine, it's the best in the world of any large country.
Mr. Javid, the problem with the
weakening of that link.
And the vaccination programme is outstanding. Congratulations to the NHS for that. Superb. But the vaccine does not prevent transmission. And we are seeing a rise in hospitalisations. And we have seen deaths amongst those who are double vaccinated. The link has not been broken. And, you know, that quote that I read out from the Chief Scientific Officer, cases are doubling. And if there is a rise in hospitalisations, that has an impact on other medical treatment. You have a waiting list at the NHS of over 5 million. You still have a big problem on your hands.
And you know, I'm pleased that you've mentioned that, because we should be concerned, in fact, very concerned about the waiting list, and especially all those people that in normal times would have come forward for help from the NHS that didn't receive it. And the thing that probably shocked me the most when I came into this department was to learn that there's some 7 million people, 7 million, that have not come forward for problems with cancer, with heart disease, mental health problems that have grown. And the reason that's happened is because we've had to have all these restrictions. So if what you're interested in and what your viewers are interested in is that we get on and deal with all those other health problems that have sadly built up during the pandemic, then we'd start to you have to start to ease the restrictions. And the good news is we can do that, again, because of the vaccine and the treatments that we have now that we didn't have at the start of this
Health
pandemic.
Secretary, if there's a rise in hospitalisations at the moment, that has an impact on the services that the NHS can provide to those patients.
If they rose to the kind of levels that we saw during the last wave and the wave before that, you would be right. But the reason that we believe, with the advice that we've got from the scientists, from the medical officers, why that is very unlikely to occur is because of the weakening of that link. And if I may just put a number on it, since you're very interested in it.
Because we don't know at the moment whether these restrictions may be reintroduced. And the Prime Minister did not use the word irreversible yesterday, so they may be. What is your threshold for hospitalisations before you consider restrictions again?
In terms of case numbers, if I may, because it's all linked to case numbers. So first of all, case numbers, we're around 25,000 at the moment. You said 27,000 or so in the last 24 hours. And we expect that by the time that we start easing the restrictions on July the 19th, that number would rise again significantly to maybe 50,000. And also, I have to be honest, and I always will be very straight with the British people. I think that the case numbers will rise again significantly over the summer, perhaps to as high as 100,000. But what matters more than anything is not so much the case numbers, but the impact on hospitalisation. And what we are seeing, although there is an increase in hospitalisation, it is a lot less than what we have seen before. And in terms of deaths, that is also a lot less than we've seen before. And again, just to put a number on that, if I may.
OK, but can you put a number on hospitalisations?
It's such an important point.
Can you put a number on what your limits for hospitalisations
At the moment, with 25,000 or so cases a day, the number of people in hospital in England is just under 2,000.
Talking about your threshold for new restrictions.
At the previous wave, when we had case numbers like that, we had people in hospital way above 20,000. In terms of deaths, when we had 25,000 cases before, we sadly had around 500 deaths a day, and now we're at 1/30th. Of that.
Okay. So you're saying,
if I may just take you back to a point that you made earlier, that when we also are thinking about the NHS and deaths, we have to also start thinking more about those people not getting seen with their cancer problems, with their heart disease problems, and that is why we need to start removing these restrictions.
So you're not, obviously, you're not going to give us a threshold that Susanna's asking for, but what you are saying is that your honest belief, based on the data, that these rises will be manageable and we will be able to go ahead on the 19th. I'm always fascinated by the politics of the personal in these issues. I'm just wondering if Matt Hancock wasn't in the political toaster or the political toilet, however you want to analogize it, we'd be having this conversation at all, because if he was still in post, it's very doubtful that he would have signed off on the announcement yesterday, isn't it? Because both he and Michael Gove, who is also in eclipse at the moment for personal reasons, were very strong lobbyists for continuing restrictions and continuing the protocols. You're not. You wrote a very interesting piece in the Mail on Sunday, 2 days ago, in which you said now is the time that we learn to live with the virus because, in your view, the vaccines are working. So if you weren't in post, and if Matt Hancock hadn't had the car crash politically that he'd had, do you think we'd be even having this conversation this morning?
Well, I can't speak for Matt Hancock, but what I can tell you is that when you make decisions like this in government, it's not one person making these decisions. These are tough decisions, and before you can make your mind up, you would want to absolutely consult the experts, the scientists, the medical officers, speak to your colleagues in government and make a collective decision. And also, let me be very straight with you.
Sorry, go on. Carry on, please, yes.
That when you make these decisions, we are doing it in a pandemic that no one in living memory has experience of anything like this. And so, of course, there are balanced decisions to make. And, of course, there are risks that will be taken. There's no risk-free way forward. But what we do know is that the vaccines are working. That is what has changed over the last few months. They're working not just here, but across the world, where countries have been able to get vaccines to large numbers of their people. Yeah. And the reason we've got those vaccines, and if they're working, is that we should take advantage of it as a country so that we can start dealing with all the other problems that were caused by the pandemic, that were non-health problems, and also the non-COVID health problems.
You've talked about that. Are you going to release those who are in contact with a COVID case and are double jabbed? Are you going to release those people, exempt them from isolation?
Well, the vaccines do mean that we can take a more proportionate and balanced approach to the test and trace system. And that does mean that those that are double jabbed can be treated in a different way. Exactly how we do that, I'll be talking about that later today in Parliament.
And does that apply to people coming back from amber zone holiday resorts? Will they also be allowed to simply get back to normal life? Will they have to quarantine too, if they've been double jabbed?
I think the Transport Secretary has already said that we will take a different approach to those that travel that are double jabbed from amber zone countries, and I know that he's planning to make a statement to Parliament later this week. And
you've got an NHS pay review on your desk, which you've looked at. Are you going to give the NHS workers what they want, which is a lot more than 1%?
NHS workers will get a pay rise. They deserve a pay rise. That's why they were exempted with the more general freeze. That's why the pay review bodies were asked to look into this. They've given advice to government, and we will take it very seriously.
But will you implement it if it's more than 1%?
I'm sorry, I didn't quite hear you there.
If the pay review body recommends a pay rise for NHS workers that is more than the government's proposal of 1%, will you commit to implementing it?
Well, I'm not going to preempt the outcome of this, but the pay review has, like any pay review body, they're independent, and they've given their reasons for their recommendation, and I will look at that very carefully alongside other ministers in government, and we'll come to a final decision.
All right. Thank you for your time. Good luck in the new job. Did you have to think twice about it when the phone went?
Thank you.
Did you have to think twice about it when the phone went? Poison chalice time?
No, it was an honour to be asked and to help in this way.
OK, well, good luck.